Yeah, good evening, everyone. Today we are going to discuss some of the MCQs in physiology. Yeah. In each topic, I'll be discussing 10 questions. Okay. Hope my voice is audible to everyone. One second, let me start again. Yeah. In each topic, I'll be discussing 10 of 10 questions. First question. Extracellular fluid in adults differ from intracellular fluid in that its volume is greater, tonicity is lower, anions are mainly inorganic. You have to mention me whether which is true among this and which is false. Okay. And E option is pH is lower. I repeat the question. Adults differ from intracellular fluids in that its volume is greater, tonicity is lower, anions are mainly inorganic, sodium is to potassium ratio is higher, and pH is lower. Yeah. Now, in this, the true answers are C and D are true. Why A, B, D, E are false? Because cells contain half to 2/3 of the total body fluid, right? So volume is greater is false. And in the second choice, it is tonicity is lower. It is the same. If it is like lower, osmosis would draw water into the cells. So tonicity is lower is false. And anions are mainly inorganic. That is true because mainly chloride and bicarbonate inside the mainly chloride and bicarbonate inside. The main anions are protein and organic phosphates. Okay. Then coming to D option, that is sodium is to potassium molar ratio is higher. Yes, it is true. Around 30 is to 40 is the ratio. The intracellular ratio is about 1 is to 10. Then E, pH is lower. It is false because intracellular pH is lower due to cellular metabolism. Okay. So C and D are true. Next. Blood group antigens, that is agglutinogens, are carried on the hemoglobin molecule, beta globulins, equally immunogenic, not present in fetal blood, inherited as recessive Mendelian characteristics. I repeat the question. Blood group antigens, that is agglutinogens, are carried on the hemoglobin molecule, beta globulins, equally immunogenic, not present in fetal blood, inherited as recessive Mendelian characters. Which is true among the following and which is false? See, all are false in this option. Carried on the blood group antigens are carried on the hemoglobin molecule. It is false because they are the part of the red cell membrane. Because blood group antigens are the part of the red cell membrane. Next. Blood group antigens are beta globulins. No, it is false. They are glycoproteins. Blood group antigens are glycoproteins. Next. What is the next option? Blood group antigens are equally immunogenic. It is false because A, B, and D antigens are more immunogenic than the others. A, B, and D antigens are more immunogenic than the others. So it is not equally immunogenic. And next option is blood group antigens are not present in fetal blood. It is false. Fetal blood may elicit immune responses if it enters the maternal circulation. Okay, so it is false. And last option, that inherited as recessive Mendelian characters. No, they are Mendelian dominants. Okay, blood group antigens are Mendelian dominants. So all the options are false. Next question. Total body water expressed as a percentage of body weight can be measured with an indicator dilution technique using deuterium oxide, or it is like smaller on average in women than in men, and rises following injection of posterior pituitary extracts, falls during starvation, is less than 80% in young adults. Which is the right option? Which is true and which is false among this following? Which is true and which is false among the following? Yeah. In this case, A, B, C, E are true. D is false. A, B, C, and E are true, and D is false. How? First option A. DTO, that is, which is heavy water, exchanges with water in all body fluid compartments. So it cannot be measured. What it told, it can be measured with, they told no, but it is for true. Yes, DTO exchanges with water in all body fluid compartments. So it can be easily measured with an indicator dilution technique using deuterium oxide, that is D2O. Next, second option is true. It is smaller on average in women than in men. Yeah, women carry relatively more fat than men, and fat has a lower water content. So total body water expressed as a percentage of body weight is smaller on average in women than in men. It is true. And C option is also true because it rises following injection of posterior pituitary extracts. That is, ADH is the extract in the extracts inhibits water excretion by the kidneys. ADH, antidiuretic hormone, in the extracts inhibits water excretion by the kidneys. So it is true. False during starvation. It is false because it raises as fat stores are metabolized to provide energy. Okay, next, last, it is true, that is 70%, the percentage in the lean body mass is about the maximum percent possible. So it is less than 80% in young adults. It is true. Only 70% is possible in healthy adults. Okay. Next question is breakdown of erythrocytes in the body occurs when they are 6 to 8 weeks old, takes place in the reticuloendothelial system, yields iron, most of which is excreted in the urine, yields bilirubin, which is carried by plasma protein to the liver, is required for the synthesis of bile salts. Okay. Which among the following is true and false? Can you guys please guess? Yeah. In this case, let's see the options. A. Occurs when they are 6 to 8 weeks old. No, it is false because the normal erythrocyte lifespan is 16 to 18 weeks. Okay. So occurs when they are 6 to 8 weeks is false. Next. Breakdown of erythrocytes in the body takes place in the reticuloendothelial system. Yes, it is true. The reticuloendothelial system removes effective RBCs from the circulation. Affected RBCs from the circulation. Next, breakdown of erythrocytes in the body yields iron, most of which is excreted in the urine. Yes, it is. Is it true or false? It is false because most of the iron is retained for further use. Most of the iron is retained for further use. So excreted is you in urine, it is not excreted. Okay. Next, fourth option yields bilirubin, which is carried by plasma protein to the liver. Yes, it is true. The protein makes the bilirubin relatively water soluble. The protein makes the bilirubin relatively water soluble. And last, it is required for the synthesis of bile salts. False. Bile salts are synthesized from sterols in the liver. Bile salts are synthesized from sterols from in the liver. Okay. So here B and D are true, remaining are false. B and D are true and remaining are false. Coming to the next question. A person with group A blood has anti-B antibody in the plasma, may have the genotype AB, may have a parent with group O blood, may have children with group A or group O blood only, whose partner is also A, can only have children of groups A or O. Which of them is true and which is false? I repeat the question. A person with group A has anti-B antibody in the plasma. Yes, it is true. This appears about the time of the birth. So it has anti-B antibody in the plasma. And a person with group A blood may have the genotype AB. False. This would make them blood group AB. Is it right? No. Only AB blood group will be having a genotype of AB. Okay, then a person with group A blood may have a parent with group O blood. It is true. They could inherit an A gene from the other parent to give genotype AO. They could inherit an A gene from the other parent to give genotype AO. Next, may have children with group A or group O blood only. See, B or it is false because B or AB are possible depending on the partner's genes. Only B group or AB group are possible depending on the partner's gene. Okay. Next, last option is whose partner is also A can only have children of groups A or O. This is true. In this case, neither parent has the B gene. Neither parent has the B gene. Okay. In this question, A, C, and E are true. A, C, and E are true. Next question. Plasma bilirubin. Plasma bilirubin is a steroid pigment. Plasma bilirubin is converted to biliverdin in the liver. Does not normally cross cerebral capillary walls. Plasma bilirubin is freely filtered in the renal glomerulus. Plasma bilirubin is sensitive to light. Which among the following is true and which are false? Plasma bilirubin is a steroid pigment. Plasma bilirubin is converted to biliverdin in the liver. Plasma bilirubin does not normally cross cerebral capillary walls. Plasma bilirubin is freely filtered in the renal glomerulus. Plasma bilirubin is sensitive to light. Which among the following is true and which is false? Coming to the answers. Plasma bilirubin is a steroid pigment. This false because it is a porphyrin pigment derived from heme. It is a porphyrin pigment derived from heme. Next option is plasma bilirubin is converted to biliverdin in the liver. It is false. Bilirubin is derived from biliverdin formed from heme, not the other way about. Bilirubin is derived from biliverdin formed from heme, not the other way. So it is false. Next, C option does not normally cross cerebral capillary walls. Yeah, this is true. The blood-brain barrier normally prevents bilirubin entering brain tissue. So it does not cross. The blood-brain barrier normally prevents bilirubin from crossing through. So C option is true. Next, D option. It is freely filtered in the renal glomerulus. False. The bilirubin protein complex is too large to pass the glomerular filter. The bilirubin protein complex is too large to pass the glomerular filter, so it cannot be easily filtered. And last but not least, it is sensitive to light. No, it is true. Light converts bilirubin to lumirubin, which is excreted more rapidly. Light converts bilirubin to lumirubin, which is excreted more rapidly, and phototherapy may be used in the treatment of hemolytic jaundice in children. Phototherapy may be used in the treatment of hemolytic jaundice in children. Therefore, A, B, and D are false. Only C and E are true in this case. Okay, C and E are true in this case. Next question. Monocytes originate from precursor cells in lymph nodes, can increase in number when their parent cells are stimulated by factors released from activated lymphocytes. Unlike granulocytes, do not migrate across the capillary walls, can transform into large multinucleated cells in certain chronic infections, manufacture immunoglobulins. Which among the following is true and which among the following is false? Yeah, coming to the answers. First option, it is A. That is, monocytes originate from precursor cells in lymph nodes. It is false because they originate from stem cells in the bone marrow. Monocytes originate from stem cells in the bone marrow. Second option, it can increase in number when their parent cells are stimulated by factors released from activated lymphocytes. It is true because activated T cells release granulocyte macrophage colony stimulating factor, that is GM-CSF, which stimulates the monocyte stem cells to proliferate. That is, activated T cells release GM-CSF, which stimulates monocyte stem cells to proliferate. So it is true. And third option, unlike granulocyte, do not migrate across capillary walls. It is false. After 4 to 6 days in the circulation, monocytes migrate out to become tissue macrophages. So they do not migrate. That option is false. They migrate into tissue macrophages. Next, fourth option is can transform into large multinucleated cells in certain chronic infections. Yes, it is true. The giant cells seen in tissues affected by tuberculosis and leprosy. Multinucleated cell. This is large multinucleated cell, no? So the giant cells seen in tissues affected by tuberculosis and leprosy. Next, large option is manufacture immunoglobulins. It is false, because immunoglobulins are made by ribosomes in lymphocytes, not in monocytes. They are made by ribosomes in lymphocytes. Next, coming to the next question, that is erythrocytes. Erythrocytes are responsible for major part of the blood viscosity. Second option, erythrocytes contain enzyme carbonic anhydrase. Third option, erythrocytes metabolize glucose to produce carbon dioxide and water. Next, erythrocytes swell to bursting point when suspended in 0.9% saline. And last, erythrocytes have rigid wall. Which among the following is true and which is false? Yeah, the answer is coming to the first option. Erythrocytes are responsible for the major part of the blood viscosity. Yes, it is true because blood viscosity rises exponentially with the hematocrit. Okay, hematocrit is formed by the erythrocytes, right? So, blood viscosity rises exponentially with the hematocrit. So, it is true. Next, erythrocytes contain the enzyme carbonic anhydrase. Yes, it is true. It catalyzes the reaction carbon dioxide and H and water. Combining of carbon dioxide and water releases H plus and bicarbonate. H plus and bicarbonate. 1 second. Yeah, sure, ma'am. Sure, sure. I'll go slowly. Yeah. Once again, I'll repeat the explanation. Erythrocytes are responsible for the major part of blood viscosity. It is true because blood viscosity rises exponentially with the hematocrit. Blood viscosity rises exponentially with the hematocrit. Next, second option is contain the enzyme carbonic anhydrase. It contains the enzyme carbonic anhydrase. Yeah, it is true because it catalyzes the reaction CO2 plus H2O gives rise to H plus plus bicarbonate, that is HCO3 minus. So second option is also true. Coming to the third option, metabolize glucose to produce carbon dioxide and water. Yes, it is also true because glycolysis generates glycolysis generates the energy needed to maintain glycolysis generates the energy needed to maintain electrochemical gradients across the electrochemical gradients across their membranes. Okay, so third option is also true. Next, D. Fourth option is swell to bursting point when suspended in 0.9% saline. It is false because this is isotonic with their contents. So bursting will not happen. So it is false. This is isotonic with their contents. Isotonic with their contents. Okay. Next, last option, have rigid walls. It is false because the walls deform easily to squeeze through capillaries. The walls deform easily to squeeze through capillaries. Okay, so in this thing, A, B, C are true, D and E are false. Okay, D and E are false because in D isotonic with their contents, and in E the walls will deform easily to squeeze through capillaries. Okay, that is about erythrocyte. Next question. Now, next question is lymphocytes. Okay? Lymphocytes. Lymphocytes constitute 1 to 2% of circulating white cells. Lymphocytes constitute 1 to 2% of circulating white cells. Is it true or false? Second option is they are motile, can transform into plasma cells. Decrease in number following removal of the adult thymus gland and decrease in number during immunosuppressive drug therapy. Okay. Among these options, which is true and which is false? Yeah. Coming to the answers. First option A. Lymphocytes constitute 1 to 2% of circulating white cells. This is false because about 20% of leukocytes are lymphocytes. About 20% of leukocytes are lymphocytes. So only 1 to 2% of circulating white cells means it is false. Second option, true. Because lymphocytes are motile, they migrate by amoeboid movement. They migrate by amoeboid movement to areas of chronic inflammation. Wherever the chronic inflammation is present, lymphocytes will migrate there. So they are motile. Yes, it is true. And third option, they can transform into plasma cells. Yes, it is true. As plasma cells, they manufacture humoral antibodies. As plasma cells, they manufacture humoral antibodies. Okay. Then decrease in number following removal of the adult thymus gland. It is false because the thymus is atrophied and has little function in the adult. The thymus is atrophied and has little function in the adults. Okay. Last, decrease in number during immunosuppressive drug therapy. Yes, it is true because lymphocytes and immune responses are closely linked. Lymphocytes and immune responses are closely linked. So in this thing, B, C, and E are true. B, C, and E are true. Moving to the next question. The specific gravity, that is relative density of red cells, is less than that of plasma. Plasma is due more to its protein than to its electrolyte content. The plasma decreases as extracellular fluid and electrolytes are lost. Blood is higher on average in women than in men. Urine can fall below 1,000 in a water diuresis. These are the options. Which among the following are true and which among the following are false? Yeah. Coming to the answers. First option, red cells, the specific gravity of red cells is less than that of plasma. It is false because red cells are heavier and hence sediment on standing. Red cells are heavier and hence sediment on standing. So this option is false. Second option, plasma is due more to its protein than to its electrolyte content. Yes, it is true. The mass of plasma proteins, that is 70 to 80 grams per liter. The mass of plasma proteins, that is 70 to 80 grams per liter, far exceeds that of plasma electrolytes about 10 gram per liter. The mass of plasma proteins, that is 70 to 80 grams per liter, far exceeds that of plasma electrolytes about 10 grams per liter. So it is true. And the third option, plasma decreases as extracellular fluid and electrolytes are lost. That is false because it increases. Plasma specific gravity is an index of ECF volume. It is an index of ECF volume if protein levels are normal. It is an index of ECM volume if protein levels are normal. So it is false. Blood is higher on average in women than in men. Specific gravity of blood is higher on average in women than in men. It is false. It is higher in men who have a higher hematocrit. It is higher in men who have a higher hematocrit. Okay. Last option. Specific gravity of urine can fall below 1.000 in a water diuresis. It is false. The specific gravity of pure water is 1.000. Urine is water plus solutes. Urine contains water and also solutes. So it is not below 1.000. So it is false. So in this case, B, only B is true, remaining all are false. Coming to the next option, blood. Blood makes up about 7% of body weight. Is it true or false? Blood forms a higher percentage of body weight in fat than in thin people. Blood volume can be calculated by multiplying plasma volume by the hematocrit. Blood volume rises after water is drunk. Blood expresses serum when it clots. Which among the following is true and which among the following is false? Yeah, coming to the option, answer, first option. Blood makes up about 7% of body weight. It is true. For example, if 5 kg is taken, that is about 5 liters in 70 kg of men. So 70 kg man contains 5 liters of blood. So 7% of body weight. It is true. Second thing is, blood forms a higher percentage of body weight in fat than in thin people. It is false, since fat tissue is relatively avascular. Fat tissue is relatively avascular. The reverse is true. Fat tissue is relatively avascular and the thin tissue is vascular. So it forms a higher percentage of body weight in fat than in thin people is false. Next, blood volume can be calculated by multiplying plasma volume by the hematocrit. It is false. It can be calculated by multiplying plasma volume by 1 by minus 1 minus hematocrit. It is calculated by multiplying plasma volume by 1 minus hematocrit. Okay, it is expressed as decimals, not as percentage. Next, blood volume rises after water is drunk. Yes, it is true. The water is absorbed into the blood. The water is absorbed into the blood. So volume rises. Okay. Next, last option. Blood expresses serum when it clots. It is true. Serum is plasma minus its clotting factor. So blood expresses serum when it clots. Serum is plasma minus its clotting factor. So in this case, both A, D and E are true. A, D and E are true. Next question. The cell membrane in the skeletal muscle are impermeable to fat soluble substances, are more permeable to sodium than to potassium ions, become more permeable to glucose in the presence of insulin, become less permeable to potassium in the presence of insulin, show invaginations which connect to a system of contracting coupling, excitation, contracting, coupling. Yeah. Now, which among the following are true and which among the following are false? Yeah. First option, that is cell membrane of skeletal muscle are impermeable to fat substances. It is false because the membrane consists largely of lipids. The membrane consists largely of lipids. Okay, so this option is false and are more permeable to sodium than to potassium ions. It is also false. The reverse is true. That is sodium ions being more hydrated, sodium ions being more hydrated than potassium ions. So they are larger complexes as they are larger complexes. So it is false. And this cell membrane become more permeable to glucose in the presence of insulin. It is true. Thus glucose is stored as muscle glycogen. Thus glucose is stored as muscle glycogen after a meal. Next, they become more permeable, that is, become less permeable to potassium in the presence of insulin. No, it is also false because they become more permeable. Injections of insulin and glucose lower the serum potassium level. Example is injections of insulin and glucose lower the serum potassium levels. Last, shows invaginations which connect to a system of intracellular tubules involved in excitation, contraction, coupling. It is true because these are called the T system of tubules. T system of tubules. T system of tubules. Okay. So in this case, C and E are true. In this case, C and E are true. Moving to the next question. The pH of arterial blood normally ranges from 7.2 to 7.6. The pH units expressed in hydrogen in moles per liter. The pH of blood is directly proportional to the partial carbon dioxide, that is PCO2. The pH of blood is directly proportional to the bicarbonate. And the pH of urine is usually less than 7. Less than 7. Which among the following is true and which among the following is false? Coming to the answers. The pH of arterial blood normally ranges from 7.2 to 7.6. It is false. The range is 7.35 to 7.45. The pH of arterial blood is 7.35 to 7.45. Next, the units is moles per liter. It is false. They express it as the negative logarithm of the H plus in moles and moles per liter. Negative logarithm of H plus in moles per liter. And pH of blood is directly proportional to PCO2. It is false because PCO2 raises H plus and hence lowers the pH. PCO2 raises the H plus and hence lowers the pH. The pH of blood is directly proportional to HCO3. It is true because HCO3 minus lowers the H plus by buffering and hence raises the pH. HCO3 lowers the H plus by buffering and hence raises the pH. And last thing is pH of urine is usually less than 7. That is true. The normal diet leaves acidic rather than alkaline and residues. Alkaline residues. The normal diet leaves acidic rather than alkaline residues. In this case, D and E are true. D and E are true. Lymph. Lymph contains plasma proteins. Vessels are involved, lymph vessels are involved in the absorption of amino acids from the intestine. Lymph production increases during muscular activity. Lymph does not normally contain cells. Lymph flow is aided by contraction of adjacent skeletal muscles. Which among the following is true and which among the following is false? Answers are: first, lymph contains plasma proteins. Yes, it is true. It is derived from plasma proteins leaked from capillary. Derived from plasma proteins leaked from capillaries into the tissues. It returns these to the blood. It returns these to the blood. And lymph vessels are involved in absorption of amino acids from the intestine. It is false. Lymph vessels are involved in the uptake and transport of absorbed fat. Uptake and transport of absorbed fat. So it is false. Lymph production increases during muscular activity. Yes, it is true. Increased capillary pressure due to muscle vasodilatation. That is, increased capillary pressure due to muscle vasodilatation increases tissue fluid formation. Increases the tissue fluid formation. And lymph does not normally contain cells. It is false. It contains lymphocytes derived from lymph nodes. It contains lymphocytes derived from lymph nodes. And last, lymph flow is aided by contraction of adjacent skeletal muscles. Yes, it is true. In addition, intrinsic rhythmic contraction in lymphatics, intrinsic rhythmic contractions in lymphatics helps to propel the lymph. Help to propel the lymph. Coming to next topic, that is cardiovascular system. Cardiovascular system. Coronary blood flow to the left ventricle increases during early systole, myocardial hypoxia, hypothermia, stimulation of sympathetic nerves to the heart, arterial hypertension. When the coronary blood flow increases in the left atrium, left ventricle, once again, I repeat the question. Coronary blood flow to the left ventricle increases during early systole, myocardial hypoxia, hypothermia, stimulation of sympathetic nerves to the heart, arterial hypertension. And the answer is first option. Coronary blood flow to the left ventricle increases early systole. It is false because in early systole it falls. Coronary vessels are compressed by contracting myocardium. Coronary vessels are compressed by the contracting myocardium. So early systole will not increase. And myocardial hypoxia. It is true. A fall in CO2, that is partial oxygen, has a potent vasodilator effect on coronary vessels. It has a potent vasodilator effect on coronary vessels. Adenosine released from hypoxic myocardium is also a potent vasodilator. Adenosine released from hypoxic myocardium is also a vasodilator. Next option is hypothermia. No, it is false. The fall in metabolic rate and cardiac output in hypothermia reduce cardiac work and lead to reduction in coronary blood flow. Okay. The fall in metabolic rate and cardiac output in hypothermia reduces cardiac work and lead to reduction in coronary blood flow. And next, stimulation of sympathetic nerves to the heart. It is true. Sympathetic stimulation increases the rate and force of contraction. The resulting increase in the rate of production of vasodilator metabolites dilates the coronary vessels. Metabolites dilate the coronary vessels. So it is true. Next, it increases during arterial hypertension. Yes, it is true. Myocardial work and metabolism are increased in hypertension. Okay. Next question. Local metabolic activity is the chief factor determining the rate of blood flow to the heart, skin, skeletal muscle, lungs, and kidney. Which among the following is true and which among the following is false? Yeah. Local metabolic activity is the chief factor determining the rate of blood flow to the heart. Yes, it is true. There is a close relationship between the work of the heart and coronary flow. So it is true. And the skin, it is false. Skin blood flow is geared mainly to thermoregulation and normally exceeds the needed for skin's modest metabolic requirements. Okay, so it is false. And skeletal muscle, it is true. Local blood flow is largely determined by the vasoactive metabolites such as rising PCO2, H plus concentration, and falling PO2. The changes produced by vasomotor nerves are small compared with those produced by metabolites. So it is true in case of skeletal muscle. And in case of lung, it is false because the entire cardiac output must pass through the lungs regardless of the entire cardiac output must pass through the lungs regardless of the local metabolic needs of the pulmonary tissues. It is greatly in excess of the lungs metabolic needs. Okay. So it is false. In case of kidneys, it is false. As in skin, renal blood flow, about 1/4 of total cardiac output, greatly exceeds local metabolic needs. The blood is sent to the kidneys for processing. So local metabolic activity is the chief factor determining the rate of blood flow to the heart and skeletal muscle, not for skin, lung, and kidney. Okay, next question. The second heart sound differs from the first heart sound in that it is related to turbulence setup by valve closure, longer lasting than the first sound, higher in frequency, occasionally split, heard when the ventricles are relaxing. Which is true among the following? Yeah, the answers are the second heart sound differs from the first heart sound in that it is related to turbulence set up by the valve closure. Yes, it is false because it applies to both the heart sounds, right? So there is no point in telling about single heart sound here. So A is false. And coming to B, it is false again. Longer lasting than first heart sound, but it is about 20% shorter. Second heart sound is 20% shorter than first heart sound and higher in frequency. Yes, it is true. About 50 hertz compared with 35 hertz from the first sound. 50 hertz more than the compared with 35 hertz for the first sound. And occasionally split. It is false. Both may be split due to asynchronous valve closure. Both the heart sounds may split due to asynchronous valve closure and heard when the ventricles are relaxing. Yes, it is true. The first sound is due to ventricular systole. The second occurs during ventricular relaxation when the aortic valves snap shut as ventricular pressure falls below aortic. Okay. So in this case, C and E are true. High with higher frequency and heard when the ventricles are relaxed. So this the differs from first heart sound. Okay. Sinoatrial node cells are found in both atria, innervated by the vagus, unable to generate impulses when completely denervated, and connected to the AV node by fine bundles of Purkinje and able to generate impulses because their membrane potential is unstable. Which among the following is true and which among the following is false? Yeah, answers are sinoatrial node cells are found in both atria. It is false because the SCA node is in the right atrium near its junction with the SVC, that is superior vena cava. And second option, it is innervated by the vagus. Yes, it is true. Vagal activity slows the rate of impulse generation and thus the heart rate. So it is innervated by the vagus. And sinoatrial node cells are unable to generate impulses when completely denervated. That is false. SK node has intrinsic rhythmicity and can generate impulses independently. So it can generate impulses independently. There is no point in denervating and all. So C is false. And D, connected to the AV node by fine bundles of Purkinje tissue. It is false. Purkinje tissue is confined to the ventricles. Atrial fibers conduct impulses from SCA to the AV node. So that is false. Able to generate impulses because their membrane potential is unstable. Yes, it is true. Impulse generation is due to spontaneous diastolic depolarization of the cells. Spontaneous diastolic depolarization of the cells. So E is true. Coming to the next question. Cardiac output. Cardiac output is normally expressed as the output of one ventricle in liters per minute and may not increase when heart rate rises. Usually rises when a person lies down. Cardiac output rises in a hot environment. Cardiac output does not increase in exercise following denervation of the heart. Which among the following is true and which among the following is false? Coming to the answer. Cardiac output is normally expressed as the output of one ventricle in liters per minute. Yes, it is true. The output from the left and right ventricle is the same. The output from the left and right ventricle is the same. And cardiac output may not increase when heart rate rises. It is true because it depends on what happens to stroke volume. So it is true. It depends what happens to stroke volume. And cardiac output usually rises when a person lies down. It is true. Yes, lying down normally increases the filling pressure of the heart. So it is true. Lying down normally raises the filling pressure of the heart. So it is true. In that case, cardiac output increases and rises in a hot environment. Yes, it is true. To meet the needs of increased metabolism and increased skin blood flow, it rises in hot environment. Okay. Then coming to the last option, does not increase in exercise, showing denervation of the heart. It is false. The output does increase due to changes in the filling pressure, level of circulating hormones, etc. The output does increase due to changes in the filling pressure, level of circulating hormones, etc. So E is false. Next question. The jugular venous pulse is not visible in normal healthy people. The jugular venous pulse has greater amplitude in patients with tricuspid incompetence. The jugular venous pulse can vary widely in amplitude in patients with complete heart block. Jugular venous pressure is raised in patients with right ventricular failure. The jugular venous pressure is commonly raised in patients with mediastinal tumors. Which among the following is true and which among the following is false? The jugular venous pulse is not visible in normal healthy people. Is it true or false? It is false. It can be seen in healthy people when they lie almost flat. The jugular venous pulse is not visible in normal healthy people is wrong because it is seen when we lie down. And second option is pulse has greater amplitude in patients with tricuspid incompetence. Jugular venous pulse has greater amplitude in tricuspid incompetence. Yes, it is true. Systolic regurgitation of right ventricle blood can cause giant waves. So it has tricuspid in greater amplitude in tricuspid incompetency. That is systolic regurgitation of right ventricle blood can cause giant waves. And third option is true. That is, pulse can vary widely in amplitude in patients with complete heart block. Yes, it is true. This is an important, that is like this is like periodic giant waves are seen when atrial and ventricular systoles coincide. So periodic waves can be seen. So it is true. And D is true again. Pressure is raised in patients with right ventricular failure. Yes, this is an important sign in right ventricular failure. That is, venous pulsation is present. Venous pulsation is present. Last, pressure is commonly raised in patients with mediastinal tumors. It is true again. The jugular veins are distended due to venous obstruction, but there is little or more or no pulsations. The jugular veins are distended due to venous obstruction, but there is little or no pulsation. That is about jugular venous pulse. What happens in heart failure? The resting cardiac output may be higher than normal. True or false? In a heart failure, the resting cardiac output may be higher than normal. Is it true or false? It is true. In high output failures, however, the ability to raise cardiac output in exercise is impaired in all types of failures. So it is true. And in heart failure, the atriovenous oxygen difference during exercise is less than in normal people. It is false because with inadequate output, desaturation of blood in the tissues increases. With inadequate output, desaturation of blood in the tissue increases. Okay. Next, there is in heart failure, there is sodium retention. Yes, it is true. This increases the extracellular fluid and hence blood volume. It increases the extracellular fluid and hence the blood volume. And in heart failure, edema occurs in dependent parts of the body. Yes, because the back pressure in veins raises capillary hydrostatic pressure and results in edema in dependent parts. That is, back pressure in veins raises the capillary hydrostatic pressure, which results in edema in the dependent parts when venous pressure is already raised to the gravity. And last, pulmonary in heart failure, pulmonary edema occurs when pulmonary capillary pressure doubles. It is false because when pulmonary capillary pressure doubles, it's still less than plasma oncotic pressure. That is, if it is doubled, it is 5 like pulmonary capillary pressure is 5 mmHg, whereas plasma oncotic pressure is 25 mmHg. If 5 is doubled, it is just 10 and it is not more than oncotic pressure. Okay, so it is false. Coming to the next question. Pain due to poor coronary blood flow, that is angina, may be relieved by cutting the sympathetic nerve trunks, supplying the heart, and correcting the anemia if present, providing the patient with a cold environment, beta adrenoreceptor stimulating drugs, drugs causing peripheral vasodilation. Which among the following is true? Yeah. Pain due to poor coronary blood flow may be relieved by cutting the sympathetic nerve trunks supplying the heart. It is true or false? It is true because pain sensory fibers from the heart travel with the sympathetic nerves. Pain sensory fibers from the heart travel through the sympathetic nerves. So if it is cut and the pain will be relieved. And by correcting the anemia if present, it is true. In anemia, the capacity of the blood to deliver oxygen is decreased, but cardiac works increases due to the raising cardiac output. Okay, so it is true. Providing the patient with a cold environment, it is false because cold vasoconstriction raises the arterial pressure and so increases the myocardial work. So Cold vasoconstriction raises the arterial pressure and so increases the myocardial work. So providing the patient with a cold environment is false. And beta adrenoreceptor stimulating drugs, giving beta adrenoreceptor stimulating drugs, it is false. These drugs increase heart rate and force and so increase myocardial work and so increase the myocardial work. Last, by giving drugs causing peripheral vasodilation, it is true. By reducing arterial pressure, vasodilator drugs such as nitrates reduce the myocardial work. So E is true. Coming to the next topic, that is respiratory system. The respiratory center is the respiratory center is in the hypothalamus. The respiratory center sends impulses to inspiratory muscles during quiet breathing. The respiratory center sends impulses to expiratory muscles during quiet breathing. And the respiratory center is involved in the swallowing reflex. The respiratory center is involved in the vomiting reflex. Which among the following is true? Which among the following is true? The respiratory center is in the hypothalamus. The respiratory center sends the impulses to the inspiratory muscles during quiet breathing, sends impulses to expiratory muscles during quiet breathing, and it is involved in the swallowing reflex and is involved in the vomiting reflex. Coming to the answers, first one, the respiratory center is in the hypothalamus. False. It is in the medulla oblongata. It is in the medulla oblongata. And the respiratory center sends impulses to inspiratory muscles during quiet breathing. It is true because it causes expansion of thorax cage. It causes the expansion of thorax cage in the inspiratory muscles. Send impulses to expiratory muscles during quiet breathing. It is false because expiration at rest is passive. Expiration at rest is passive. And it is involved in the swallowing reflex. It is inhibited during swallowing, so preventing the aspiration of food. It is inhibited during swallowing, preventing the aspiration of food. It is involved in the vomiting reflex. It is true. Expiratory, including abdominal muscle contraction with the esophagus relaxed and the glottis closed, helps the expel gastric contents in vomiting. So it is involved in vomiting reflex. Okay. Coming to the second question. The carotid bodies. The carotid bodies are stretch receptors in the walls of the internal carotid arteries. It is true or false? It is false. The stretch receptors in internal carotid arteries are carotid sinus baroreceptors. The carotid bodies are separate structures nearby. The stretch receptors in internal carotid arteries are carotid sinus baroreceptors. So it is false. Carotid bodies have a blood flow per unit volume similar to that in the brain. It is false again. They have the greatest flow rate or unit volume yet described in the body. Okay, they have the greatest flow rate or unit volume yet described in the body. And carotid bodies are influenced more by blood PO2 than by its oxygen content. Yes, it is true. They are not excited in anemia where PCO2 is normal but O2 content is low. They are not excited in anemia where PCO2 is normal but O2 content is very low. And next option, that is carotid body generates more afferent impulses when blood H plus ion concentration rises. It is true again. Acidosis stimulates the ventilation. Acidosis stimulates the ventilation. And last, carotid bodies and the aortic bodies are mainly responsible for the increased ventilation in hypoxia. It is true. When carotid and aortic bodies are denervated, hypoxia depresses the respiration. Hypoxia depresses the respiration. Coming to the next question. Pulmonary surfactant increases the surface tension of the fluid lining alveolar walls. Pulmonary surfactant increases lung complaints. Pulmonary surfactant increases in effectiveness as the lungs are inflated. Pulmonary surfactant increases in amount when pulmonary blood flow is interrupted. Pulmonary surfactant increases in amount in fetal lungs during the last month of pregnancy. Which among the following is true and which among the following is false? Answers are the surface tension of the fluid lining alveolar walls. Pulmonary surfactant increases the surface tension of the fluid lining alveolar walls. It is false. It decreases the surface tension. It decreases the surface tension. And pulmonary surfactant increases lung compliance. It is true. It permits the lungs to be more easily inflated. It permits the lung to be more easily inflated. And pulmonary surfactant increases in effectiveness as the lungs are inflated. It is false. The decreasing effect as lungs inflate helps prevent overinflation. Prevents overinflation. So it is false. Pulmonary surfactant increases in amount when pulmonary blood flow is interrupted. This falls again. It decreases. This may lead to local collapse of the lungs. It decreases, which may lead to local collapse of the lungs. And last, pulmonary surfactant increases in amount in fetal lungs during the last month of pregnancy. Yes, it is true. Premature babies may have breathing problems due to surfactant deficiency. Premature babies may have breathing problems due to surfactant deficiency. The work of breathing increases when lung complaints increases. This is true or false? The work of breathing increases. First, let us see the question. The work of breathing increases when lung compliance increases. This is true or false. Next option is the work of breathing increases when the subject exercises. Next, the work of breathing increases when the rate of breathing increases even through the minute volume stays constant. Minute volume stays constant. And the work of breathing increases when the subject lies down. When the subject lies down. The work of breathing increases when the subject lies down. And last option is the work of breathing increases when functional residual capacity increases. When the functional residual capacity increases. Which among the following is true and which among the following is false? Sorry for the inconvenience. And now we'll move on to the questions. The work of breathing increases, the lung compliance increases. The work of breathing increases when the subject exercises, and the work of breathing increases when the rate of breathing increases, even though the minute volume stays constant. The work of breathing increases when the subject lies down. The work of breathing increases when functional residual capacity increases. Um, what among the following is, which among the following is true and which among the following is false? Coming to the answers, first option, that is the work of breathing increases when lung compliance increases. That is yeah. The work of breathing increases when lung compliance increases. It is false because compliant lungs are easier to inflate. So it does not increase. The work of breathing increases when the subject exercises. It is true since the rate and depth of ventilation are increased. And the rate of breathing increases even though the minute volume stays constant. It is true again. The work of breathing is minimal around the normal rate of breathing. The work of breathing is minimal around the normal rate of breathing. The work of breathing increases when the subject lies down. Yes, it is true because the increase in pulmonary blood volume increases the lung stiffness and abdominal pressure on the diaphragm rises, because the increase in pulmonary blood volume increases and lung stiffness and increases the lung stiffness and abdominal pressure on the diaphragm also rises. So when the subject lies down, the work of breathing increases. And the work of breathing increases when functional residual capacity increases. It is true again. Lung complaints falls at higher lung volumes. Higher lung volumes. Moving to the next question. Respiratory dead space saturates inspired air with water vapor before it reaches the alveoli. This true or false? It is true because this prevents the drying of alveolar space. This prevents the drying of alveolar space. And second option, respiratory dead space removes all particles from inspired air before it reaches the alveoli. Yes, it is false because particles less than about 2 microns can reach the alveoli. Only particles less than 2 microns of size can reach the alveoli. And respiratory dead space decreases when blood catecholamine levels rise. It is false because catecholamines relax airway muscle and constrict mucosal vessels the mucosal vessels. Respiratory dead space decreases during a deep inspiration. False because expansion of lungs expands airways as well as alveoli. So it is false. Expansion of the lungs expands airways as well as alveoli. And respiratory dead space decreases during a cough. Yes, it is true because this allows the air to be expelled at high airway velocity. High airway velocity. Next. Coming to the next question, that is bronchial asthma is likely to be relieved by stimulation of cholinergic receptors and stimulation of beta adrenoreceptors and histamine aerosols and drugs which stabilize mast cell membranes and corticoids. Which among the following is right and which among the following is false? Yeah, first one. Stimulation of cholinergic receptors. Yes, it is true. This is not true because this causes bronchoconstriction. Stimulation of cholinergic receptors causes bronchoconstriction. So bronchial asthma cannot be relieved. And the second option is stimulation of beta adrenoreceptors. That is, it is true because this causes relaxation of the bronchial muscle. Stimulation of beta adrenoreceptors causes relaxation of the bronchial muscle. So it is true. And third is histamine aerosols. That is false because histamine is a bronchoconstrictor. It is not a bronchodilator. It is a bronchoconstrictor. So C is also false. And D, drugs which stabilize mast cell membranes. Yes, it is true. The chromoglycate drugs are thought to work like this and reduce release of bronchoconstrictor agents from mast cells. So it is true. And the glucocorticoids, yes, it is true again. This suppresses the bronchoconstrictor and inflammatory mechanism. So bronchial asthma is likely to be relieved by stimulation of beta adrenoreceptors and by the drugs which stabilize mast cell membranes and glucocorticoids. Okay. Next, coming to the next question, that is air in the pleural cavity, that is pneumothorax, allows intrapleural pressure to rise to atmospheric pressure and it causes the underlying lung to collapse by compressing it, increases the functional residual capacity, leads to a slight outward movement of the chest wall, reduces the vital capacity. Which among the following is true and which among the following is false? First thing, allows intrapleural pressure to rise to atmospheric pressure. Yes, it is true because air flows in since the pressure in the cavity is normally subatmospheric. Air flows in since the pressure in the cavity is normally subatmospheric. And second option, that is causes the underlying cells, the lungs to collapse by compressing it. It is false. Except in tension pneumothorax, pleural pressure does not exceed intrapulmonary pressure, that is atmospheric pressure, and collapse is due to elastic recoil of the lungs. Collapse is due to elastic recoil of the lungs. So it is false. And increases the functional residual capacity. Air in the pleural cavity increases the functional residual capacity. It is false. It decreases the lung collapses. If it decreases as the lung collapses and leads to slight outward movement of the chest wall. The elastic recoil of the lung is no longer applied to the chest wall. The elastic recoil of the lung is no longer applied to the chest wall. And last, it reduces the vital capacity. The lungs cannot be fully inflated. The lungs cannot be fully inflated. So it reduces vital capacity. So it is true. Okay, it is true. Now, next question. Cyanosis may be caused by high level of carboxyhemoglobin in the blood, which is and may be caused by high levels of methemoglobin in the blood. Cyanosis is seen in fingers of hands immersed in iced water. Cyanosis occurs more easily in anemic than in polycythemic patients. Cyanosis is severe in cyanide poisoning. Which among the following is true and which among the following is false? First one, may be caused by high level of carboxyhemoglobin in the blood. It is false. Carboxyhemoglobin is pink and gives the skin a pinkish color. Not cyanosis is nothing but bluish discoloration of the skin, right? So carboxyhemoglobin is pink and gives the skin a pinkish color. So it is false. May be caused by high level of methemoglobin in the blood. Yes, it is true. This blue pigment is a rare cause of central cyanosis. This blue pigment is a rare cause of central cyanosis. So it is true. And it is seen in fingers of hands immersed in iced water. It is false. The fingers are red. Cold inhibits oxygen dissociation and reduce the metabolism. So it does not seen in immersed hands of iced water. Then occurs more easily in anemic than in polycythemic patients. It is false. Cyanosis occurs when arterial blood contains more than 5 grams per dl reduced hemoglobin. When arterial blood contains 5 grams of reduced hemoglobin, more than 5 grams of reduced hemoglobin. Low hemoglobin values in anemia make it difficult to reach this level. Okay, low hemoglobin values in anemia make it difficult to reach this level. So it is not seen in anemic patients. And in severe in cyanide poisoning, false. Cyanide poisons the enzymes involved in O2 uptake by the tissues. In cyanide poisoning, the blood remains fully oxygenated and the skin is pink in color in cyanide poisoning. Okay, so it is false again. And last question, that is coughing. Coughing is reflexly initiated by irritation of the alveoli, which is true or false. It is reflexly initiated by irritation of the alveoli. No, it is false. It reduces it by at least half. Reduces it by at least half. And coughing is associated with relaxation of airway smooth muscles. It is false again. Contraction narrow airways and increases the velocity of flow. So relaxation of airway smooth muscles, coughing is wrong. And coughing depends on contraction of the diaphragm for expulsion of air. Coughing depends on contraction of the diaphragm for expulsion of air. It is false again. It depends on expiratory muscles, particularly abdominal muscles. It depends on expiratory muscles, particularly abdominal muscles. Coughing differs from sneezing in that the glottis is initially closed. Yes, it is true because it is more explosive than sneezing. It is more explosive than sneezing. Coughing is depressed during anesthesia. Yes, this may lead to retention of mucus secretions, which may lead to retention of mucus secretions. Coming to the next topic, that is digestive system. Bile. Bile contains enzymes required for the digestion of fat. Bile contains unconjugated bilirubin. Bile salts make cholesterol more water soluble. Bile pigments contain iron. Bile becomes more alkaline during storage in the gallbladder. Which among the following is true and which among the following is false? Yeah. First, bile contains enzymes required for the digestion of fat. It is false. Bile contains no digestive enzyme. Its bile salts assist in the emulsification and absorption of fat. It does not contain any digestive enzymes. Bile contains unconjugated bilirubin. False. The bilirubin is conjugated by the hepatocytes before excretion. The bilirubin is conjugated by hepatocytes before excretion. Bile salts make cholesterol more water soluble. True. By forming cholesterol micelles. By forming cholesterol micelles, the salts make cholesterol more water soluble. Next, bile pigments contain iron. It is false. Iron is removed from heme. Iron is removed from heme in the formation of bilirubin. Next, bile becomes more alkaline during storage in the gallbladder. It is false again. It becomes more acidic, which improves the solubility of bile solids. Next, saliva. Saliva from different salivary glands have a similar composition. It is false because serous glands such as the parotids produce a watery juice. Mucous glands such as sublingual produce a thick viscid juice. See, serous glands produce watery juice of saliva, whereas mucous glands produce thick viscid juice. So it is different in different cases. So A is false. Saliva contains enzymes essential for the digestion of carbohydrates. It is false again. The function of salivary amylase, that is ptyalin, can be affected by enzymes from other digestive glands from other digestive glands. So it is false. Saliva has less than half the ionic calcium level of plasma. It is false again. It is saturated with calcium ions. Calcium salts are laid down as plague on the teeth. Calcium salts are laid down as the plague on the teeth. So it is false again. Saliva has more than twice the iodide level of plasma. True. Saliva is an important route of iodide secretion. Its concentration in saliva is 20 to 100 times that in plasma. Saliva is an important route of iodide secretion. In its concentration in saliva is 20 to 100 times than in plasma. So it is twice, more than twice. Okay. Then saliva has a pH between 5 and 6. It is false. Saliva has a neutral pH. Acidity in the mouth tends to dissolve tooth enamel. Acidity, if it is acidified, no, our tooth enamel gets dissolved. So it is not acidic or it is not alkaline. It is, it maintains a neutral pH. It maintains a neutral pH of 5 and between 5 and 6. Moving to the next question. Swallowing is a reflex which has its reflex centers in the cervical segments of the spinal cord. It is true or false? It is false. The reflex centers lie in the medulla oblongata, not on cervical segment. So it is false. Swallowing is a reflex which includes inhibition of respiration. It is true. This plus closure of the glottis prevents food being aspirated into the airways. So it includes inhibition of respiration. Okay. Next. Swallowing is a reflex which is initiated by a voluntary act. It is true because the voluntary act is propulsion of a bolus of food onto the posterior pharyngeal wall. Propulsion of a bolus of food onto the posterior pharyngeal wall. It is a voluntary activity. So it is initiated by voluntary activity. It is true. Swallowing is a reflex which is dependent on intrinsic nerve networks in the esophagus. It is true again. These are essential for the peristaltic phase. Peristaltic phase. And the last, swallowing is a reflex which is more effective when the person is standing rather than when lying down. It is true. Gravity can assist the reflex. Tablets are more difficult to swallow when lying down. Tablets are more difficult to swallow when lying down. And that way, gravity can assist the reflex. Moving to the next question. Appetite for food is lost when certain hypothalamic areas are stimulated, when certain hypothalamic areas are destroyed, when the stomach is distended, when the stomach is surgically removed, and when blood glucose falls. First, certain hypothalamic areas are stimulated. It is true. For example, when the satiety centers are stimulated. If the satiety centers are stimulated, appetite for food is lost. And certain hypothalamic areas are destroyed. It is true again. For example, hunger centers. If the hunger centers are damaged and the appetite is lost. And when the stomach is distended, it is true. Appetite is relieved after a meal before the food products of digestion are absorbed into the blood. Okay, so it is true again. And the stomach is surgically removed. It is false. The drive to eat does not depend on an intact stomach. The drive to eat does not depend on intact stomach. And blood glucose false. It is false again. It increases and hypothalamic glucostats detects the low glucose and excites the hunger centers to generate the emotional drive to eat. So when the blood glucose level falls, it does not lose the appetite. Okay, moving to the next question. Defecation is a reflex action that is coordinated by reflex centers. True or false? Reflex center in the sacral cord. Is true or false? True, because reflex defecation can occur after complete spinal cord transection. Reflex defecation can occur after complete spinal cord transection. Next. Defecation is a reflex action whose afferent limb carries impulses from stretch receptors in the colon. It is false because the stretch receptors triggering the reflex are in the rectal wall. Okay, they are in the rectal wall. So it is false again. Defecation is a reflex action whose efferent limb travels mainly in the sympathetic autonomic nerves. It is false again. Parasympathetic nerves are the main motor nerves for defecation. Parasympathetic nerves are the main motor nerves for defecation. And defecation is a reflex action which is more likely to be initiated just after a meal than just before it. Yes, it is true because the wish to defecate that follows a meal is attributed to a gastrocolic reflex. The wish to defecate after a meal is attributed to a gastrocolic reflex. And last, defecation is a reflex action which can be voluntary, inhibited, or facilitated. Yes, it is true. Forced expiration against a closed glottis facilitates the reflex by raising intra-abdominal pressure and pushing feces into the rectum. That is by inspiration. And contraction of the voluntary muscle of the external sphincter can inhibit it. So it is true again. Coming to the next question. In the stomach, pH rarely falls below 4. Pepsinogen is converted to pepsin by hydrochloric acid. Ferrous ion is reduced to ferric ion by hydrochloric acid. Acid secretion is inhibited by pentagastrin. There is a rise in the bacterial count after histamine H1 receptor blockade. Which among the following is true? First one, pH rarely falls below 4 in stomach. It is false. Value around 2 to 3 are normal. Rarely false is false because it is always like around 2 to 3 are normal. Next, pepsinogen is converted to pepsin by hydrochloric acid. No, it is again true because pepsin is the active proteolytic form of pepsinogen. Pepsin is the active proteolytic form of pepsinogen. So it is true. Ferrous ion is reduced to ferric ion by hydrochloric acid. Ferrous ion is reduced to ferric ion by hydrochloric acid in the stomach. It is false because HCl reduces the trivalent ferric iron to the divalent ferrous form in which it can be absorbed in the small intestine. So option C is false again. And in the stomach, acid secretion is inhibited by pentagastrin. Acid secretion is inhibited by pentagastrin. It is false again. Pentagastrin is a powerful pharmacological stimulant of mucosal cells to produce HCl. Mucosal cells to produce HCl. And last option, that is in the stomach, there is a rise in bacterial count for after histamine H1 receptor blockade. It is false because it raises markedly after H2 blockade, which blocks gastric acid secretion. So E is also false. Moving to the next question. The liver is the principal site for synthesis of plasma albumin, synthesis of plasma globulin, synthesis of vitamin B12, storage of vitamin C, and storage of iron. Which among the following is true? First one, synthesis of plasma. Liver is the principal site for synthesis of plasma albumin. It is True. Plasma albumin concentration falls in liver failure. Plasma albumin concentration falls in liver failure. And liver is the principal site for synthesis of plasma globulin. False. Immunoglobulins are produced by ribosomes in the lymphocytes. Ribosomes in the lymphocytes. And liver is the principal site for synthesis of vitamin B12. It is false again. Vitamin B12 is ingested in food, absorbed complex with intrinsic factor in the terminal ileum and stored in the liver liver. So it is false again. The liver is the principal site for storage of vitamin C. It is false. Vitamin C is not stored. Any in excess of requirements is excreted in the urine. Vitamin C is not at all stored in our body. In any excess form, it is released in the urine, and it helps in the storage of iron. Yes, it is true. Iron released from heme from broken down RBCs is stored in the liver for future hemopoiesis. So it is true in this case. Next. Saliva is necessary for digestion of food, swallowing of food, normal speech, antisepsis in the mouth, and taste sensation. Which among the following is true? First one, digestion of food. It is false. Other digestive tract enzymes can take over if salivary enzymes are absent. So, other than salivary enzymes are also absent, digestion can be done. So, only for digestion of food is wrong. And swallowing of food, it is false. But swallowing solids is difficult without saliva's moisturizing and lubricant effects. Okay. Swallowing solids is difficult without saliva's moisturizing and lubricant effect. But liquids can be swallowed, right? So it is wrong again. Normal speech, yes, it is true. Nervous orators with the dry mouths continuously sip water. Nervous orators with dry mouths continuously sip water. So for normal speech, it is necessary. And saliva is necessary for antisepsis in the mouth. It is true. In the absence of saliva, the mouth becomes infected and ulceration occurs. In the absence of saliva, the mouth becomes infected and the ulcerations occurs. Okay, so it is antisepsis in the mouth is true. And substances must taste. Saliva is necessary for taste sensations. Yes, it is true. Substances must go into solution before they can stimulate taste receptors. So saliva is necessary for taste sensation also. Going to the next question. Bile salts are the only constituents of the bile necessary for digestion. Bile salts have a characteristic molecule, part water soluble and part fat soluble. Bile salts are reabsorbed mainly in the upper small intestine, and bile salts are derived from cholesterol. Bile salts inhibit bile secretion by the liver. Which among the following is true and which among the following is false? Yeah. Bile salts are the only constituents of bile necessary for digestion. It is true or false? It is true. They emulsify fat, creating a greater surface area for lipase to act on. They emulsify fats, creating a greater surface area for lipase to act on. So bile salts are the only constituent for bile necessary for digestion. Next. Bile salts have a characteristic molecule, part water soluble and part fat soluble. It is It is true again. This property allows them form to micelles for fat transport. This property allows them to form micelles for fat transport and are reabsorbed mainly in the upper small intestine. It is false. They are absorbed in the terminal ileum. They are absorbed in the terminal ileum. And bile salts are derived from cholesterol. True. They are synthesized from cholesterol in the liver. They are synthesized from cholesterol in the liver. Bile salts inhibit bile secretion by the liver. False. They are cholerectic substances which stimulate bile secretion. They are cholerectic substances which stimulate bile secretion. Moving to the next topic, that is nerve muscle physiology or neuromuscular system. As we don't have much time, I'll move faster, a little faster. First question. A reflex action is initiated at a sensory receptor organ. A reflex action may result in endocrine secretion. A reflex action may involve transmission across at least two central nervous synapses in series. A reflex action may be excitatory or inhibitory. A reflex action is independent of higher centers in the brain. Which among the following is true and which among the following is false? Yeah. Coming to the first option. A reflex action is initiated at least at a sensory receptor organ. Is it true? Because stimulation of the receptor generates impulses in the afferent limb. A reflex action may result in endocrine secretion. Yes, it is true. Stimulation of osmoreceptors reflexly modifies ADH output from the posterior pituitary gland. From the posterior pituitary gland. And a reflex action involves transmission across at least two central nervous synapses in series. It is false because the knee jerk reflex R contains only one central nerve synapse. So all the central nervous synapses will all the reflex actions will not have two central synapses. Okay. So it is false. The reflex action may be excitatory or inhibitory. True. In the knee jerk, extensors of the knee contract while flexors relax. That is reciprocal inhibition. Okay, so it is excitatory or inhibitory. The reflex action is independent of higher centers in the brain. False. Higher centers can facilitate or inhibit many reflex actions such as micturition. Moving to the next question. A skeletal muscle fiber membrane in a skeletal muscle fiber membrane is negatively charged on the inside with respect to outside at rest. True or false? True, because this resting membrane is potential is about minus 90 millivolts. Minus 90 millivolts. A skeletal muscle fiber contains intracellular stores of calcium ions. It is true. These are released on excitation. And a skeletal muscle fiber is normally innervated by more than one motor neuron. It is false. A single neuron supplies a group of muscle fibers. A single neuron supplies a group of muscle fibers. A skeletal muscle fiber becomes more excitable as its resting membrane potential falls. True, because it becomes more excitable as its membrane potential approaches the firing threshold. It becomes more excitable as its membrane potential approaches the firing threshold. That is about minus 70 millivolts. And the skeletal muscle fiber becomes less excitable as the extracellular ionized calcium level falls. It is false again. Decreasing extracellular calcium ions increases the excitability and may lead to spontaneous contraction, that is tetany, possibly by increasing sodium permeability. By increasing the sodium permeability. Okay, moving to the next question. The blood-brain barrier slows the equilibration of the solutes between the blood and the brain tissue fluids, which is true because capillary permeability is lower in the brain than in other tissues. The blood-brain barrier is a more effective barrier for fat-soluble substances than water-soluble substances. It is true or false? It is false because fat-soluble substances cross readily due to the lipids in the cell membranes. Fat-soluble substances cross readily due to lipids in the cell membrane. And blood-brain barrier is more effective barrier in infants than in adults. False. The reverse is true. That is bilirubin, which cannot pass in adults, does so in infants. Bilirubin cannot pass in adults, does so in infants. So it is more effective in adults than in infants. So it is false. The blood-brain barrier is more effective barrier for CO2 than for O2. It is false again. Both CO2 and O2 cross the blood-brain barrier easily. So it is more effective in both CO2 and O2. So it is false again. The blood-brain barrier permits hydrogen ions to pass freely. False. This protects the brain tissues against sudden changes in the pH of blood. This protects the brain tissue from sudden changes in the pH of blood. So it does not permit hydrogen ions to pass freely. Moving to the next question. In skeletal muscle, contraction occurs when its pacemaker cells depolarize sufficiently to reach the threshold for firing. Is it true or false? In skeletal muscle, it is false. Skeletal muscle has no pacemaker cells and shows no spontaneous activity. So it is false. Next option. In skeletal muscle, calcium is taken up by the sarcotubular system when it contracts. Is it true or false? It is false again. Calcium is released from intracellular stores when it contracts. And actin and myosin filaments shorten when it contracts. In skeletal muscle, actin and myosin filaments shorten when it contracts. It is false. The filaments do not shorten but slide together over one another. It do not shorten. They slide over one and another. And in skeletal muscle, the sarcomeres shorten during contraction. It is true. There is a great overlap of actin and myosin fibrils. So sarcomere gets shortened. And in skeletal muscle, contraction strength is related to initial length of the muscle fibers. It is true. Moderate stretch increases the contraction strength as in the heart. Moderate stretch increases the contraction as in the heart. So it is true. Moving to the next question. Saltatory conduction occurs only in myelinated fibers. True or false? True. Excitation leads from node to node across the myelinated segment. Saltatory conduction is nothing but conduction from one node to another node, right? So occurs only in myelinated fibers. And saltatory conduction does not depend on depolarization of the nerve membrane. False, because the membrane does depolarize at the node. The membrane does depolarize. And saltatory conduction has a slower velocity in cold than in warm conditions. True, because cooling slows sodium conductance at the nodes. And saltatory conduction is faster than non-saltatory conduction in nerve fibers with diameters around 10 meters. It is true. Theoretically, saltatory conduction becomes slower in nerve fibers with diameters less than 1 micrometer. And saltatory conduction transmits impulses with a velocity proportional to fiber diameter. It is true. And to the distance between nodes. Transmit impulses between the nodes. Okay, so it is true again. Moving to the next question. Stimulation of the vagus nerve causes a reduction in the strength of ventricular contraction. It is true or false? False, because ventricles have little vagal innervation. Ventricles have little vagal innervation, and stimulation of vagus nerve causes secretion and vasodilatation in the salivary glands. It is false again. The vagus do not supply parasympathetic nerves to salivary glands. The vagus do not supply parasympathetic nerves to salivary glands. Next, stimulation of the vagus nerve causes mucus secretion from bronchial mucosal cells. It is true. It also contracts bronchial smooth muscle. It also is the contraction of bronchial smooth muscle. And stimulation of the vagus nerve causes the spleen to contract. False. It is sympathetic activity that causes the spleen to contract, not the vagus nerve. And stimulation of vagus nerve causes the gallbladder to contract. True. This, together with relaxation of the sphincter of Oddi, drives bile into the duodenum. Drive bile into the duodenum. This is about stimulation of vagus nerve. Next, coming to the action potential. An action potential in a nerve occurs when its membrane potential is hyperpolarized to a critical level. It is false, because it occurs when the membrane potential is reduced to its threshold for firing. When the membrane is reduced to its threshold for firing. And next, an action potential is a nerve fiber is associated with a transient increase in membrane permeability to sodium. It is true. This leads to rapid depolarization towards the sodium equilibrium potential. This leads to rapid depolarization towards the sodium equilibrium potential. An action potential in a nerve fiber is associated with a transient decrease in the membrane permeability to potassium. It is false again. Permeability to potassium increases and the resulting K plus efflux, that is potassium efflux, contributes to membrane repolarization. Membrane repolarization. An action potential in a nerve induces the local electrical currents in adjacent segments of the fiber. True. This depolarizes the adjacent axon and leads to propagation of the impulse. And an action potential in a nerve fiber has an amplitude which varies directly with the strength of stimulus. No, because of all or none law, impulse configuration is independent of stimulus strength. According to all or none law, impulse configuration is independent of stimulus strength. So it is false again. Moving to the next question. Non-myelinated axons differ from myelinated axons in that they are not sheeted with Schwann cells. It is false, because both types have Schwann cells. Both type of, that is myelinated and non-myelinated axons, have Schwann cell sheets. So it is wrong. And non-myelinated axon differs from myelinated axon in that they are not capable of regeneration after section. False. Following the section, the central end of the axon buds and grows down the Schwann cell sheath until it reaches its target organ. Not capable is wrong. It is capable. Okay. And found only in autonomic nervous system. False again. Some sensory fibers serving pain and temperature are unmyelinated C fibers. Some sensory fibers serving pain and temperature are unmyelinated C fibers. So, no, only in autonomic nervous system is wrong. And they are less excitable. Yes, it is true. Myelinated fibers have a lower threshold for stimulation. Lower threshold for stimulation. And refractory for a long period after excitation. 2 meter, that is compared with 0.5 milliseconds. 2 milliseconds compared with 0.5 milliseconds in well myelinated nerves, and myelinated fibers can transmit impulses at higher frequencies than unmyelinated nerves. So it is true. And moving to the next question. Resting nerve cell membranes are more permeable to organic anions than to chloride ions, and potassium ions than to chloride ions, sodium ions than to potassium ions, oxygen molecules than to glucose molecules, water molecules than to hydrogen ions. First one, resting nerve cell membranes are more permeable to organic ions than to chloride ions. It is false because organic ions cannot cross the membrane readily. Organic ions cannot cross the membrane readily. And permeable to potassium ions than to chloride ions. It is false again. The permeable to chloride ions is about twice that of potassium ions. Twice that of potassium ions. And the sodium ions than to potassium ions. It is false again. Potassium permeability is about 100 times than that of sodium ions. Potassium ions permeability is about 100 times than that of sodium ions. So it is also false. And permeable to oxygen molecules than to glucose molecules. Yes, it is true. Myelinated fibers have a lower threshold for, that is, O2, being a small non-polar lipopolic molecule, dissolves in the membrane lipid and crosses more easily than the larger glucose molecule. So it is true. Water molecules have than to H plus ions. It is true. The bilipid layer is more permeable to water than to charged hydrogen ions. The ankle jerk reflex is exaggerated when the arm muscles are voluntarily contracted. True or false? It is false because it is not exaggerated, but contraction of arm muscles reinforces the reflex. Ankle jerk reflex is exaggerated immediately after complete spinal cord transection at the cervical level. False, because immediately after cord transection, reflexes below the level of the lesion are lost in the stage of spinal shock. And ankle jerk reflex is exaggerated on the left side some months after damage to the tracts in the right internal capsule. It is true because muscle tone increases following contralateral internal capsular lesions. Contralateral internal capsular lesions. And the ankle jerk reflex is exaggerated in extrapyramidal system disorders such as Parkinsonism. It is false because though muscle tone is increased, tendon jerks are not exaggerated. And the ankle jerk reflex is exaggerated when cerebellar function is lost. It is false again. Muscle tone is low following cerebellar damage, and the knee jerk in pendular. The knee jerk is pendular. Yeah. Moving to the next topic, that is special senses. Okay. Special senses. Olfactory cells. Just a minute. Yeah, actually, yesterday I did not cover the endocrine, so let me go with endocrine system first. Yeah, endocrine system. During sleep, there is a fall in circulating level of cortisol, insulin, adrenaline, antidiuretic hormone, and growth hormone. Which among the following is true? Which among the following is true? Yeah, it is cortisol because the waking catabolic state changes to an anabolic state. In the waking, the catabolic state changes to anabolic state. And insulin is true again. Insulin secretion occurs mainly in association with meals. Insulin secretion occurs mainly in association with meals. So it is again insulin. And adrenaline, it is false, it is true again because adrenaline secretion is associated with stress. Adrenaline is associated with stress. Insulin is associated with food, and cortisol, insulin, and adrenaline, there will be a fall during circulation, during sleep. And antidiuretic hormone, it is false. This rises as the plasma osmolality rises. Water is lost but not replaced during sleep. Water is lost but not replaced during sleep. And the growth hormone, this is false again. This increases, allowing the growth and anabolic repair of tissue wear and tear. Anabolic repair of tissue wear and tear. Adrenocorticotropic hormone secretion increases when the median eminence of hypothalamic is stimulated. It is true because the median eminence secretes corticotropin releasing hormone, that is CRH, the releasing hormone for ACTH, and adrenocorticotropic hormone. So it is true. And ACTH secretion increases when the aldosterone blood levels falls. It is false because aldosterone secretion is regulated mainly by the renin-angiotensin system. Renin-angiotensin system. When and ACTH secretion increases when when cortisol blood levels falls. When cortisol blood levels falls. True, because this negative feedback helps to maintain the blood cortisol level. Just you see, like when the blood cortisol level, this negative feedback, no, it helps in the maintenance of blood cortisol level. And ACTH secretion increases in bursts during the night as the normal hour of awakening approaches. That is true again. This is part of the circadian rhythm which produces high morning cortisol levels. High morning cortisol levels. And ACTH secretion increases following the severe trauma. It is true. Most forms of stress increase ACTH output by their neural input to the median eminence of the hypothalamus, where CRH is formed. CRH is nothing but corticotropin releasing hormone. Today we discussed so only some of the topics in the physiology, and we are remaining with some reproductive system and some questions in the endocrine system. So thank you so much for your support. Stay safe. And ma'am, shall I wind up, ma'am?
Yes, yes. Thank you.
Yeah, thank you. Thank you.